Chronic pain affects millions and millions of people all across the world every day. It's like a disease in itself. It causes physical limitations. It prevents sufferers from doing the things they like to do for recreation or the physical things that are required of their occupation. It could even affect mental state. Current medical approaches to treating chronic pain involve harmful medications, particularly narcotics, opioid-based medicines that often lead to nausea and constipation and dependency. You have aspirin and ibuprofen, which are toxic to the liver and kidneys, and cortisone injections, which can weaken your connective tissue, your ligaments and tendons and muscles over time. There are surgical procedures that deaden nerves, and some pain management centers can embed special neural stimulators that stimulate the spinal cord directly. But what is exactly chronic pain and how does it get started? Well, most of the time it's from an injury, it's some kind of trauma event. The body goes through its natural stages of healing, but it isn't complete. Research shows that chronic pain is a complex condition that involves not only physical components, but also a mental or psychosomatic component. Chronic pain usually begins with some type of injury, whether it's a slip, a fall, a sports injury, a car accident. The force of the impact trauma could be so significant that it misaligns joint surfaces. And after the body goes through its normal stages of healing, that misalignment persists and during the course of movement continues to aggravate the area. This can cause accelerated wear and tear of cartilaginous structures, ligaments, tendons. It could cause bone spurs to form and encroach upon adjacent nerves or other tissue. And as these nerves continually fire, those nerve pathways tend to take residence in the spinal cord and the various centers in your brain that modulate the pain. When someone is in pain for such a long time, it could cause depression, it could cause anxiety and stress. Not being able to engage in recreational activities, not being able to go outdoors and run. Now this can affect your body's ability to heal itself as well. So because of all these factors, it's no surprise why chronic pain is such a big problem in the United States and all over the world. The message I want to get out today is that the one thing that's not being emphasized in the treatment of chronic pain is lifestyle modifications centered on nutrition and movement. While exercise, stretches, physical therapy are good, if your body is not optimized for healing, then you're not going to get as good results as you're capable of getting. It's like trying to grow a garden in toxic soil. It just won't work. The plants will come out small, malformed, or they'll die prematurely. You have to clean the soil before you can expect to grow something that's going to thrive. You have to infuse your body with nutrients, clean air. You need to detoxify it. This will increase your body's chances of regenerating those injured areas. Your body is essentially a colony of trillions of cells that are interrelated and dependent on one another. For example, your intestinal cell has a connection to your brain cell, and they have a connection to your muscle cell. Think of your cells as little tiny people. Just like the whole organism, that's you. Cells need to breathe oxygen, they need to get nutrition, they need to eat, and they need to get rid of toxins. That's why it's important to have a strategy to cleanse your cells and create a situation where your cells can efficiently utilize nutrients and remove wastes and aspirate so that they can carry out the functions for which they were designed. For example, a muscle cell is designed to contract and expand. An intestinal cell is tasked with ensuring that only the macronutrients and micronutrients make it into your bloodstream. Your liver cells, your hepatocytes, are tasked with detoxification, creating many enzymes and cofactors that are related to many biological functions throughout your body. And of course, your brain cells are tasked with cognition, memory, motor, and sensory function in your body. So doesn't it make sense to maximize the function of each cell in your body? Pretty soon I'll be coming out with a comprehensive multimedia course on how to manage chronic pain using lifestyle modification. It's going to include key strategies on things that you could do that are within your abilities so that you could increase the chances of your body regenerating on its own. Stay tuned, I'll be releasing a couple more videos in the next couple of weeks to tell you more about this great new program that I think can help millions and millions of people. So if you have chronic pain, pain that's not resolving, pain that's been with you despite getting treatments from multiple types of providers, you feel like you're at the end of your rope, maybe you feel resigned to having to live with this for the rest of your life, don't give up hope. There is a way, and I'm going to try to help you get out of chronic pain. Thanks for watching. Talk to you soon.